Patient has central line inserted. Patient is hospitalized for more than 5 days. They have not given when this catheter was inserted. There are two factors here that you have to remember. Why have I given such a tricky question? What is the primary diagnosis for this patient? Why was the patient admitted? Is there any other system involved? Respiratory system was involved. So this patient had pneumonia. Is it possible that the positive organism that they are telling, which they recovered from blood, was a culprit in pneumonia? It is quite possible, right? So this could also be what? Secondary bloodstream infection. Okay? But here we'll take the answer as CLABSI because they have emphasized on how they took culture from both the sides, and what is this known as? Differential time to positivity. Central line flags positive 2 hours before the peripheral line. Okay? How many of you understood what is this? Peripheral side से blood लिया और central line से भी blood लिया. This is one of the diagnostic criteria for CLABSI. What else should be there along with this? Some clinical symptoms should be there. What clinical symptoms does this patient have? Hypertension. So, patient is going into sepsis, right? Okay. Now, what is the pathogenesis of bloodstream infections? In this case, what could you say in hospitalized patient? Which device is inserted here?
Catheter.
Central line, you could say. What is the central line? What is the central line? Central line is a that is inserted into great vessels. Which site is preferred mostly? Veins, right? Subclavian vein, jugular vein, femoral vein. Why femoral vein is not preferred site? It's close to the genital area and can bear greater risk than other sites. What else? You can, what are the sites from where the organisms can go through? Like there is a skin flora on patient's body. The skin flora is there. From where you are inserting the catheter, if you do not prepare this site properly, how are you preparing? What is skin preparation? You're using chlorhexidine. So, patient's own flora can go into the bloodstream. Then, any other site infection can go into the bloodstream. In this case, there was pneumonia also there. It could be anything, abscess, UTI, anything, right? What else could be there? While manipulating the central line, what are we using central line for? ब्लड खींचने के लिए यूज कर रहे हो, हीमोडायलिसिस के लिए यूज कर रहे हो, टोटल पैरेंटल न्यूट्रिशन दे रहे हो पेशेंट को, प्रेशर मापने के लिए यूज कर रहे हो. तो ये सब जब तुम करते हो उस टाइम पे यू आर मैनिपुलेटिंग द सेंट्रल लाइन. तो उसको जब टच कर रहे हो, whenever the patient's attending staff is manipulating this, it is possible that their hands are contaminated and this will go into the central line. So there is one term called as scrub the hub. What is this term? Scrub the, what do you understand by this? Hub is where all the external tubings are attached. So whenever you are manipulating this central line, you have to take an alcohol swab and rub it properly for 15 seconds. Every time you are manipulating the central line, you will do this. Okay, what is the next question? Common risk factors. Risk factors can be divided into 3 types. Yes, use the mic. Whoever wants to tell the answers, please, you are most welcome, because you should take part. Otherwise, I'll just keep speaking. You won't understand anything.
Ma'am, one can be patient factors, one is device factors, and the one is caregiver factors. Ma'am, patient factors would include diabetes mellitus as it is implicated over here, then any immunocompromised condition, then age would be age above 65 or 70 years would be a factor, and severe malnutrition and pre-existing any kind of distant infections like pneumonia which is given over here. And device factors would include the duration of the catheterization, then the femoral side central line if it is done, and the type of the catheter material and multi-lumen catheter. Caregiver factors would be insertion of the catheter or the central line without proper sterile barriers, then poor hand hygiene.
So there are two things. What is care bundle? You know about care bundle? She mentioned about insertion types of risk factors. What is care bundle? Care bundle is something you follow when you are handling these devices. It's a evidence based, मतलब इस पे काफी research और study हुआ है. उसके बाद हमने decide किया that we should follow this insertion bundle and maintenance bundle. So insertion bundle is something when you are inserting these devices, you will follow certain rules such as skin preparation, covering the area properly, wearing PP suit properly. So central line, you might not have seen how the central line is inserted, but whoever is inserting the central line has to follow proper hand hygiene. He has to don up every PP suit, then have to cover the skin area of the patient, prepare it properly. Insertion technique should be up to the mark. Then sometimes USD guidance is also taken. Sterile tubings are used. There should be no breach in the manufacturing. All of these things are properly seen, and then only you insert this. This is known as insertion bundle. What is maintenance bundle? I told you about scrub the herb. That is maintenance bundle. Every day you have to see for the any sign of local infection. इसके लिए जो सेंट्रल लाइन होता है उस एरिया पे आपको ट्रांसपेरेंट ड्रेसिंग यूज करते हैं. ट्रांसपेरेंट ड्रेसिंग इसलिए यूज करते हैं ताकि आप लोग ये देख सके कि उसमें कोई लोकल साइन ऑफ इन्फेक्शन तो नहीं दिख रहा है. अगर ट्रांसपेरेंट नहीं है तो आपको इस ड्रेसिंग को हर ऑल्टरनेट डे पे प्रॉपरली चेंज करना है. ठीक है. ऑल दीज थिंग्स आर मेंटेनेंस बंडल. व्हाट अबाउट द डायग्नोसिस? Which sample you will take? Huh? Blood sample. You will take blood sample. What will you do with the blood sample? You will take it for culture. How many pairs you will take? Okay. One from central line and peripheral side. Then what is the criteria? Can you tell me the criteria here? You told that there is catheter criteria. Central line is inserted. Okay, in this case it's inserted. What happens next? If the patient is less than 1 year of age, 1 साल के अंदर का बच्चा है, उसको क्या दोगे? उसमें क्या हो सकता है? Here it was Staphylococcus aureus. So this is LCBI 1, laboratory confirmed bloodstream infection 1. Because age is 65 years old and pathogen is identified pathogen, Staphylococcus aureus. अगर यहाँ पे staph epidermidis होता या फिर cons होता, commensal होता कोई, तो you have to have 2 positive blood cultures with 1 sign and symptom. Okay, it could be fever, hypertension, all of this. In case of neonates, you have to consider hypothermia. ठीक है? In case of commensals, अगर neonates में भी तुमको staph मिल रहा है तो that is also LCBI 1. Okay? जब central line लगा हुआ है patient को, then it becomes CLABSI. And CLABSI is used for what? Surveillance only. CLABSI is a surveillance term. You cannot write on the patient's file, the patient is having CLABSI. You cannot treat patient for CLABSI. So what do you have to say? When you have to treat the patient, what do you have to write? Catheter-related bloodstream infection, CRBSI. And from that, the treatment depends. Okay? What are the preventive strategies? We already discussed. It's care bundle and role of infection control practices also covered into that. What do you have to follow here? Standard precautions. Okay? What are standard precautions? Enlist. Can you enlist the standard precautions? Hand hygiene, proper PPE, cleaning, disinfection, right? Safe injection practices, all of this. What is the empirical treatment? What is empirical treatment? Anyone?
Can you repeat the question? Repeat the question.
What is empirical treatment?
Empirical.
Use the mic.
एंड ब्लड कल्चर करने के पहले
On करो.
में एक ब्रॉड
Cockroach
स्पेक्ट्रम
kill.
एंटीबायोटिक ब्लड कल्चर करने के पहले देते हैं इसको एम्पिरिकल थेरेपी.
I can't understand. Loudly. On है.
हम एक ब्रॉड स्पेक्ट्रम एंटीबायोटिक is given before the blood culture or blood collection of the blood for the blood culture. That is called the empirical therapy.
Okay, very good. So, whenever you have to start on the immediate treatment and specimen-based, test-based answers are not available, you start this patient on broad-spectrum antibiotics, which might cover both the sides of organism, gram-negative, gram-positive, right? After, once you have the report, you have the sensitivity pattern for particular organism which is identified in the patient specimen, then you can tailor this accordingly. You can de-escalate or escalate the antibiotics, okay? But initially, to cover both the sides, you have to start on the empirical treatment. Okay, understood? This covers the first question. Second question is, what is the answer? Malaria. How many of you wrote malaria? How many of you think it's otherwise, anything else than malaria? Any differential? Okay. Give mic to this side. So, this is not a new question. You have already been acquainted with malaria so many times from the school times because it's so important to our community. So, we expect all the answers from you. What is hinting you over here about malaria? What are 3 signs and symptoms that pointed you towards malaria? Hello? ऐसे नहीं, माइक दो इनको. कहाँ गया माइक?
Fever and chills, splenomegaly.
Okay. What else? Occupation वगैरह मैटर करता है?
Not that much.
Not that much, right? Occupation is an integral part of the history. Okay. First question, would you like to answer? What is the pathogenesis? No. Who wants to tell the life cycle of malaria very nicely? Who remembers it by heart? Anybody wants to volunteer? Urmimala?
Bite of the female Anopheles mosquito releases the sporozoites in the
Why
bloodstream.
why female Anopheles mosquito?
It is the vector for the malaria.
Anybody else? Why female Anopheles mosquito? Huh? Because female Anopheles mosquito, keep the mic to yourself. Female Anopheles mosquito wants to lay eggs. For that, she needs 2 blood meals before she lays eggs. So the male mosquito only feeds on fruits, and only female mosquito has to lay eggs, and that's why she's feeding on your body for blood meal. Okay? आगे बोलो.
It releases the sporozoites in the bloodstream. Sporozoites enter the liver and undergo the hepatic cycle. It forms merozoites, which are released in the blood, enters the RBC and forms tropozoites, ring form, scisont, and then it ruptures, releasing the trophozoites, which can either undergo the erythrocytic cycle once again or it can form gametocytes, which are taken up by the bite of another female mosquito, Anopheles mosquito. Inside the mosquito, it undergoes the sexual phase of the malaria cycle.
And then
Inside the gut, it forms, and in the salivary glands, once again, the sporozoites are formed.
anybody can elaborate the pre-erythrocytic stage properly? Okay, sit. Anybody wants to volunteer for the pre-erythrocytic stage? Bolo, why are you guys not volunteering? You can just read from the book. Who wants to read? Who is part? Yeah. Read. Pre-erythrocytic stage.
Pre-erythrocytic stage occurs in the liver mainly. And
So it is also known as?
also known as hepatocytic stage. Then it erythrocytic stage, pre-erythrocytic stage and stage, dormant stage. Pre-erythrocytic stage mainly sporozoid transform into merozoites. And some sporozoid transform into hypnozoites in the liver.
Okay, what happens if they are transformed into hypnozoites?
Recrudescence, hypnozoid.
What is relapse and what is recrudescence?
Relapse mainly drug.
Anybody who wants to help him? We don't have much time. Fatafat answer karo.
Recrudescence means drug resistance.
Okay, and relapses?
Symptoms due to reactivation of Hypnozoite.
Give him.
Reappearance of malarial symptom due to reactivation of Hypnozoite.
This is?
Reappearance of malarial symptom due to
What is this? Relapse or recrudescence?
relapse.
Relapse. And recrudescence is? Anybody from this side properly who will tell? Relapse and recrudescence. You have been given 2 questions. Does not mean you focus on only one answer.
Sir, recrudescence means reappearance of malarial symptom due to survival of parasite due to inadequate treatment.
That's what he mentioned before, right? Drug resistance. Okay. ठीक है, sit. Next question. Clinical features. What are the clinical features in this case? Question number 2, people are very lame, don't want to answer anything.
High grade fever, chills, फिर splenomegaly, rigors, body ache, stomach ache.
Can you classify fever? What is squatting fever? What is tertian? What is which day recurrence is there?
High grade fever.
How does it depend? Okay, you have not told the species of this parasite. Can anybody tell?
What is the question?
What are the Plasmodium species you know about that infect humans?
Falciparum,
Okay, and
Vivax, Knowlesi.
Knowlesi is there in India?
No.
What else? Falciparum, oval, Knowlesi, Malaria, and Vivax. Okay. So, what about the laboratory diagnosis? What is the gold standard? Peripheral blood smear. Thick and thin smear. Thick smear for quantification. Thin smear for speciation, identification of the species. Can you tell some characters? Falciparum में क्या दिखता है? One by one. Okay. In first stage, not directly gametocyte. What happens in the beginning? Amoeboid shape. Where is it seen? What is seen in Vivax? And in Falciparum? A cold form is seen in which? What else can you call it? Double ring form is seen in which? बोलो? Blue shirt? नहीं बोलोगे? पता नहीं? क्यों? You had this question in exam, no? What did you write there? Did you find anything else other than what is given in the books for prevention strategies and vaccination and global elimination programs about malaria? Anybody from this side? What is MBBSP? What is National Vector-Borne Disease Control Program?
ACT.
Who's answering?
ACT.
Huh. Give him the mic.
Artemisinin in combination therapy.
Okay, you found out about artemisinin combination therapy. I'm asking what is NVBDCP? Okay, elaborate on artemisinin combination therapy. Where is it used? In what case? What have you written for the management? You, yes. Give him the mic.
Individual level is use of mosquito net, mosquito bed net, mosquito repellent, then diagnosis if it persists. And at community level, it is killing of use of larvicidal fish for killing of the larvae in water accumulating places like ponds and ditches and sewage drains. Then
What is gambusia?
Larvicidal fish.
Fish. What does it feed on? Okay, where do you get this fish? So this is one of the control programs run by the Indian municipal corporations. If you have water tanks at home, you can go and collect these fishes from the municipal office and put it in your tanks. Okay? Rest, everything is given in the book. You just need the willingness to participate. Group A did very well. Question B was a very common question, but you did not answer better.